Good afternoon, everyone. Thank you for attending Independent Center of Northern Virginia's The Ins and Outs Getting Your Benefits. Today, we are hosting a benefits counseling webinar. Tracee Gardner is a 15-year veteran of Independent Center of Northern Virginia. She is our guru of Medicaid and Social Security services. Tracee is the program manager for peer supports at ECNV. This webinar is an opportunity for individuals or for you to understand the Medicaid and SSI process and is here to give information and learn about the process of applying as it relates to Northern Virginia. So just give a warm welcome to Tracee. She has slides and is willing to stay behind a few minutes to answer any questions that you may have. Thank you, Tracee.
Thanks so much, Pansy, and good greetings, everyone. I appreciate Pansy for putting all this together, this webinar that we're having today. And like she said, my name is Tracee Garner. I am Peer Support Programs Manager, also a Benefits Enrollment Counselor. We have a grant for the Benefits Enrollment Counseling, and we have had it since last year. And it may be ending soon. So we are trying to enroll as many people as we possibly can before our end of contract. Today's agenda, I'll be telling you just briefly about ECNV. You can, of course, learn more about that at our website at www.ecnv.org. About myself and Lelena, who's not currently here today, because she is currently working with lots of people that are trying to enroll and get their benefits programs. But her and I are the only benefits enrollment counselors at the Independence Center, even though we have a staff of almost over 30 people. We have 5 core benefits that fall under the benefits enrollment counseling program. So we are enrolling people for those 5 core benefits that you may be able to access and we will help you qualify for. There are a couple of additional benefits that are not considered the 5 core ones, and we'll just overview those briefly. How do you get help? We'll be answering that. You want to use the benefits finder tool to gather all your documents, which you can do independently of us, and we'll show you how to do that. What to do if you are denied any of the programs that you try to qualify for. How long does it take? And then, of course, we'll entertain any questions you may have. If you need captions, we do have captions. You can turn those on, and you can also email us anytime you have questions if you can't think of them right now here today. And we will share our contact information at the end. First, the Independence Center is a non-residential center for independent living. We do a lot of informational referral, advocacy. We help people learn to live independently or as independently as possible. That may mean with help or a living caregiver or even a roommate or shared housing, congregate housing, group homes. We help with peer mentoring, peer counseling. One of the unique things about the Independence Center, which was founded in 1982, we're celebrating, I think, 43 years that we've been in existence. And there are 17 centers like us throughout Virginia. There are 400 centers nationwide. We serve currently Arlington, Fairfax, Loudoun, the cities of Alexandria, Fairfax, and Falls Church. But just of note, for the BEC program, the Benefits Enrollment Counseling, we will serve people from all over Virginia. It's the one program at the Independence Center that does help people if you don't live in these 7 areas. So if you are living in Richmond or, Roanoke, anywhere outside of Northern Virginia, Fredericksburg, we will still help you, but only with the benefits enrollment counseling. If you need these other services, we would refer you to one of the other 16 independent living centers in Virginia. And even if you move out of state There are over 400 centers for independent living nationwide. So you can, there's a website that you can type in your zip code to find the nearest center near you that will help you with some of these same services. I won't cover all the services that we have, but this is a nice overview and you can read more about them on our website, as I mentioned. There's between Lalina and I, there's 17 years. Lalina is new and was hired part-time to be a benefits enrollment counselor. And also we are available to work with you one-on-one and help you qualify and to see, why don't you qualify so we can see if we can make some things happen to get you qualified. We both complete the benefits applications. I do a lot of energy share. Lelena does a lot of LAHEAP, which is a reduced energy program. If you qualify, that is income based. So not everyone will qualify. And then I work also specifically on SSI and SSDI, Social Security Insurance and Supplemental Security Disability Insurance. Those programs, which I will overview briefly, but they are very involved programs, lots of little parts, but I'll at least give you a general overview of what each of those programs are. To receive services from us and to get benefits enrollment counseling, one of our requirements is that you be a person with a disability or you be working with someone who has a disability. You may be a family member, a mom or dad, or even a sibling or aunt and uncle, or even just a caregiver. It really doesn't matter so long as you're helping someone who has a diagnosed disability. You need to live in the state of Virginia. For BEC, again, it's all of Virginia, not just our 7 other areas. Certain aliens and immigrants. So we wouldn't say there's an outright no to, but it really does depend on your immigration status. And so long as you're not subject to a warrant for deportation, you may qualify for some benefits. We will look at all benefits to see if you qualify. SSI, you have to be disabled by the Social Security Administration's definition and have limited income and own not too many things. Obviously, you can probably have a house and you want to put your assets in a trust so they don't count against you, but you can't, for instance, have a 501, I'm sorry, a 401k and thousands of dollars in the bank just sitting. SSI is really for the poorest of the poor and has no assets that they can liquidate and then sell for the things they need. SSDI, you need to have worked at least 40 quarters, which is only 10 years at minimum. Then you'll be able, if you've paid into the system by working, you should be able to withdraw and get money out of the system. How much you're going to get will vary depending on the types of jobs you have and the earnings that you have had. It's really an average of your earnings and how much you were paid hourly. You could be 65 years of age if you're not disabled to get some of the benefits that we have. And you have to have limited income and resources, which is kind of a prerequisite. These are the 5 core programs that we are enrolling people for. And there are 2 others, like I mentioned. So there's 7 total. But these, under the grant that we have from the National Council on Aging, is the grant maker. And there's actually only 3 benefits enrollment counselor centers in Virginia. And they're all in Northern Virginia. So that's why we decided, after some conversations, to go ahead and expand to do benefits enrollment counseling for all of Virginia, because the other 2 centers are a Korean center that is also in Arlington, and then the Arlington government, the Arlington Health and Human Service government is also a benefits enrollment counseling center. So with it all clustered here, who's kind of helping the rest of Virginia, which is why we also help all of Virginia. Medicare Part D, or low income subsidy. I'm going to overview all of these programs briefly, what they pay for, so you can know if that should be something you want to look into and apply for. Medicare Savings Plan, Medicaid, Supplemental Nutrition Assistance Program, also known as food stamps. It's called SNAP. Low Income Energy Assistance Program, also known as LAHEAP. The other three programs that we have, I kind of lumped together, number 7 and 8. I just call them SSI/SSDI because they're very similar. But Energy Share, which will give you a $500 credit annually. You can only apply for it once every year, and it will go to your Dominion or your Washington gas bill. Those are the providers in Virginia. So if you want $500 towards your Dominion bill, there is a form to fill out, and those forms we will put either in the notes or somewhere that you can access it. You can also go to the website and the form is there. Or we will put $500 credit to your gas bill. You could also split the $500 if you have both companies providing energy, and you could put $250 towards each one, but it will not exceed $500. And you do need to reapply every year, even if you've applied and gotten it. We want to make sure your home address is up to date, the number of people that are still in your house, and it's just really, it's a very simple form. It should only take you about 3 to 5 minutes to complete. SSI, Supplemental Security Income, and SSDI, Social Security Disability Insurance Program. We have a whole other webinar that we have done with the ARC of Northern Virginia. It may even be on their website, on their YouTube channel. I do a workshop only on SSI and SSDI to help people understand, and that is a very almost 90-minute workshop. So I can't possibly cover everything about SSI and SSDI in this session because we're really just talking about the 5 core services. Medicare Part D, the low income subsidy program, is to help you pay for the rising drug costs. Any medications like Ozempic or diabetes medication like metformin, if those things cost you more than you can possibly pay, you may need to, you may be able to qualify for Medicare Part D so that you can get extra money. They may give you a card that when you go to your pharmacy, you pay your amount that you have to pay out of pocket, and then the Medicare Part D would pay for whatever else is left if you can't pay the whole thing. It'll be really good. You can get a medications list and see what your costs would be just by going to the Medicare website. They have a whole book on various things that's very helpful. It's a little bit tedious to read, but at least you would know what kinds of medications you are taking and if they cover it, and sometimes about how much they would cover. So Medicare Part D is only for medications that you're having trouble paying for each month. It works in tandem with your existing insurance and healthcare coverage. Medicare Savings Plan. This is a plan that is federally funded. People with limited income to pay Medicare costs. So if you have a surgery or if you have a hospital bill or ER bill, Medicare may be able to help you pay for some of this. Probably not all of it, but at least some of it to help reduce the costs of the final costs of what it's going to be to you. What's important to know about this particular program is that you may have a copay based on whatever your take-home monthly pay is. If you are receiving SSI or SSDI, if you have a part-time job, all of those things will be taken into consideration before Medicare can make its plan about how much they're going to contribute. It is income-based, and it's based on what your take-home pay is. So they will look at all your earnings first and decide you have a 20% copay, a 30% copay, what have you. So you may not be responsible for 100% of your surgery costs, but you may, based on your income, still have to pay anywhere from 20 to 30%, which is still really good, and you're not having to pay the whole thing. Medicaid is really the overall arching insurance program by the federal government and state that gives you health care coverage to people with limited income and resources. If you are not insured by an employer because you're not working or you don't work enough hours to get health insurance, Medicaid may be an option. Medicaid really essentially is the Affordable Care Act, giving everyone some way, and it's also based on income. You may have a copay, you may have a premium that you have to pay each month in order to have this kind of coverage. But if you don't have any income, you probably will be covered. And if you don't have any income and you have a disability or are 65, you may be covered 100%. You only need one or the other. You don't have to be 65 and disabled. You can be just disabled and no income, or you can be 65 and no or limited income. To apply for the Medicaid, you would go to the Common Health website, which is commonhealth.virginia.gov. These are the requirements. You must be a resident of Virginia. And everywhere it's called Medicaid in all the states. It's just there may be a different office that you apply through. Often it's through the Department of Medical Assistance Services, DMAS, or your local Health and Human Service office or social services. Those are usually the types of offices that will help you apply or give you an application. You must be a US resident and have lived in the country for at least 5 years. So if you are an immigrant, if you have not been here 5 years and you didn't come through any kind of medical asylum, then you would have to be here at least 5 years before you can apply for Medicaid. You must meet the income and resource limits based on your household. You must be a US citizen or a qualified non-citizen. Certain groups, children and women who are pregnant, elderly and/or individuals with disabilities may have different eligibility requirements. Other factors such as age, disability status, and your medical needs. Some people who are medically fragile, or some people who are facing, let's say, end stage diseases like renal failure, kidney disease, types of cancers, and you don't have any income may also get Medicaid. Sadly, one of the reasons they will probably give it to you is because you may not be on it for that long, and that's a very devastating thing, but they're going to give it to you and help you qualify for that reason. If you have any end stage diseases that are, and the same for disability, the same for SSI and SSDI, they have things that are called compassionate care. They have a list of disabilities and types of diseases that can expedite your Social Security application. So if you are facing an end of life stage, a terminal illness, you may be able to get your application expedited, but this is not always the case. And I always mention that it's getting even harder considering current government cuts. It's less people working, more people fired, which means cases are taking longer to process, unfortunately. Medicaid Continue, the help for asylees. This is a link to the benefits and services available for asylees through the Health and Human Service Office of Refugee Resettlement, or ORR. This is an actual office that helps look at benefits and services for any asylum seekers or asylees. Next to last is SNAP. Sadly, the average monthly amount for one person on SNAP is only $125. And it's really about that per person. If you have a family of, let's say, 4 kids, maybe you have 3 school-age children and an infant probably might be $75 because they're mostly consuming formula and hopefully being breastfed. That's probably a consideration they're making into how much they give you for a payout. You'll get what's called an EBT card, and the money will be put on the card every month that you have SNAP. You can shop at almost any grocery store, Walmart, Sam's Club, almost anywhere food is sold. The only thing that you can't really buy is diapers and alcohol. I don't know why the diapers, I understand the alcohol, of course, but there are diaper banks. So maybe that's their thinking behind not the diapers. They really want it to be around nutrition, and diapers are disposable, sadly. SNAP, also called food stamps, is the Supplemental Nutrition Assistance Program, federal and state program that gives you money each month to purchase food and other necessities. I've actually been able to see you can also use your SNAP card or EBT card at Instacart, which is really good. It's just, I would recommend, and I have suggested to people who have SNAP benefits that they do pick up if they can. You don't want your all that the money, the little money that you do have on your SNAP card to be taken up by delivery fees, taxes, and other things. You're able to pick it up or have someone pick it up for you. That would certainly save you about $30 to $40 in fees. And you need all of your money to be going to the food purchase and not somebody driving your food to you if you can. Obviously, if you can't, then that is something. I have also seen with Instacart, you may need to have a backup card just to handle some of those extra fees that the EBT card won't cover. Sadly, I recommend people get SNAP right away. The sadly part is because when you get Social Security, SSI or SSDI, SNAP often is terminated. They think that your food money is now being covered by the SSI amount, when really you need extra, you need more. But a lot of SNAP benefits do terminate and cease to exist as soon as you're approved for SSI or SSDI. I don't know why that is. That's just one of their rules. The last benefit is the LAHEAP, the Low Income Home Energy Assistance Program. Federally funded, again, that helps low-income households pay their heating and cooling. Here in Virginia, at least in Northern Virginia, Dominion and Washington Gas. This program is nationwide. So if you live in another area, you'll want to ask them about the Energy Assistance Program. And you can also ask directly about it through your provider. You could call Dominion, you could call Washington Gas and ask them if they have any hardship programs. You can also do this program through us, or the Salvation Army also has not the LAHEAP, but the Energy Share program. So this will reduce your bill from month to month, as opposed to Energy Share, which is a one-time program. The other thing with the heating and cooling costs, I recommend everyone have a weatherization, take measures to just look for leaks in your home. There's actually a special, it's called like, it's not a real gun, but it's like an energy gun. You can point it at the cracks and the seal, the window sill of your windows, and it will turn a certain color to see if drafts are coming in your doors. And one of the easiest fix to keep heat in your home, especially when it's been so cold this past winter, thank God it's finally warming up, but you can roll up a towel and put it at the door, and that will keep the drafts out. You can roll up a towel or even a blanket and put it in your windowsill, and that will keep, if drafty air is coming in your home from cracks and leaks and windows that don't quite shut, or even because your foundation of your house is starting to sag and become uneven, you want to put something, and sometimes people wrap their windows in cellophane or even plastic wrap, and you can take them off in the summer because it won't be as bad. But your house, your heating unit is working harder to keep it cool when you could just try to keep the draft out. I believe there are some places that will do a weatherization check for you, usually maybe through the fire department or even through like home repair programs that come in. And even there's a senior and elderly home improvement program in certain areas. I know there's one in Arlington and Alexandria where they come and they do a check. And then they'll let you know, they'll give you a list of where you can make improvements and how you can stop the drafts. If you stop the drafts, your heating won't work so hard, your cooling won't work so hard, and that could lower your bill. You can install Energy Star lighting and appliances. There are some tax incentives for buying new appliances like an oven, so it doesn't pull so much energy, and all the models now are more energy efficient. For your fridge, your oven, even like blenders, toasters, and dishwashers. You'll want to look and see how old those things are because they could be sucking money by the amount of water and energy they use if they have not been built in the last 5 to 10 years, and are requiring more energy, which costs you more money. And then also mold. That is another thing that can put you out of your house if it becomes unmanageable and making the air difficult to breathe. So the two differences that I say between SSI, so people can really understand, because they often get confused about which one am I entitled to. You're entitled to one, not both. There are very, very few circumstances where you would be getting both of these programs at the same time. One instance would be if you are a disabled adult whose parent is retired. You might be getting SSI for yourself, and you may be able to get some monies from a retired parent, but that is a rarity. Or if the parent is deceased, you may also get SSI because you cannot work and you're disabled, and then you may have a death benefit from your either your sibling, not your sibling, but your parent or a spouse. That is the only way you would usually get both programs. Now, I say that SSI is a benefit, and this is the real definition. It's considered a benefit because you have a disability, usually diagnosed before the age of 22. I say a little joke that, the government probably knows of some environmental factor that caused your disability, and so they want to help you out, right? So they give you a monthly amount. There's probably some truth to that, even though, we shouldn't really think that, but the environment and toxins and all kinds of things have caused disabilities. Cancer cluster towns, those cause disabilities. Agent Orange, if your dad or mom was a veteran, people that have firefighters in their family, asbestos, black lung, those are environmental disease causing disabilities that affect children being born in the womb, and everything that makes that happen is affected and can cause disabilities. So if you are severely disabled, the government is going to pay you anywhere from almost up to $960. It changes every year. It goes up and down, mostly up every year with the COLA, cost of living adjustment. So right now it's about $960 if you get SSI. If you get SSDI, that means you have worked at least some part of your life, and you need to have worked at least 10 years. If you do not have 10 years of working and you are disabled, you will get SSI. The reason why you want to get SSDI is because you want to try to work and pay into the system, which means you could get anywhere from $900 all the way to $2,000. Most people get SSDI at about $1,500. And you can actually look before you start applying. I encourage people to set up a Social Security account at ssa.gov and to see what their earnings would be. It even has a line item that says, if you were to become disabled now, this is what you would receive. And as soon as you apply for SSDI, that little PDF that you can print out, a Social Security statement for yourself, disappears. I've seen it happen many, many times. As soon as people start their application, they take down that statement because they don't want you to have proof. This is what you said I might get. It is a suggestion. It's not a guarantee. So it is a payout for having paid into the system, and now you want to withdraw. And again, just SSDI is legitimate jobs. A lot of people don't get as much as they should If they are self-employed because they have not done their taxes properly, and so it brings the average down, or if they're being paid under the table or paid in cash. You want a job where you get a check, a pay stub that shows this is how much you paid into Social Security. That is the proof. If you're going to work some little piddly jobs where you only get cash, or you're just paid with no real paper trail, this will shoot you in the foot later because it'll bring your average down. They'll say, well, we're missing, the time you worked for 4 years, so we can't average that. If they can't average it, then they just put a zero, and that will bring your average down. I have mentioned Energy Share already. It is very straightforward. It's a one-time payment of $500 for one household. Now, the person with a disability living in the household does not have to be on the bill. They don't have to be named. It could be little Johnny or Susie has cerebral palsy, and both parents are on the bill, but Johnny or Susie's name is not on the bill. You just have to have someone that you care for in that house in order to get the $500. Put to Dominion or Washington Gas, and you can split it. When you submit your form online to us at ECNV, you want to make sure that you attach the bill. We can look the bill up, but it's really good if you attach it, and you need to put in your account number. SSI and SSDI cannot pay for everything, I'm sorry. It's a supplement. A lot of people think that it is the end all be all. I'll just get that and I'll live off of it, and that's just not the case. It is not enough. You're going to need other things, but it can open doors for other programs and benefits. But it can also make you lose some programs and benefits like SNAP, as I mentioned. The maximum monthly SSI payment for 2025 is $967 for an individual and $1,450 for a married couple. It's also higher if you are blind. You'll probably get anywhere from $1,900 to $2,050 if you are legally blind. About SSDI continued, based on your work earnings history payments you need to make to live. They're going to take everything to account. So you have to list everything that you are paying. It can be the reason that it will go down from 960 something is because sometimes parents will put that they provide things for their child. I always tell them, make your child seem like an independent. Of course, you know that you provide help and you pay the rent and you do everything you need, but on paper, they are an independent. They are an adult. Yes, they still live at home, but they are an adult. Can I work while I'm on disability? Yes, but I recommend you get on disability first and be not working, and then get a small part-time job where you don't earn over $1,620 a month. As soon as you earn over, this is the 2024 limit, and so it is updated for 2025. You can just Google it and it'll be there. But you can stop receiving SSDI benefits if you earn over $1,620 a month. So depending on how much you're paid per hour, and then the number of hours, you want to stay around the 20-hour-a-week range. But again, if you're making $27 an hour and you work 20 hours, that's still going to be over this. I'm talking about people that work at like Chick-fil-A they don't have greeters at Walmart anymore, but people that do some of the lower earning jobs, 20 hours a week will be just enough to supplement your SSDI payments. What can you do right now? 5 easy steps. You can go to benefitscheckup.org. You would enter your zip code, and it's going to give you a list of all the programs. There may be a bunch. There may be a bunch that are returned back to you. You can also complete the benefits enrollment form, which will be sent to both Lelena and myself. It comes directly to us. And it will say, we're going to call you. It'll give us all your information. And then somebody will reach out to you via email or phone call to schedule an appointment to talk. And you can also just email Lilina directly, but we really want to have the form so that we have a trail of who we've talked to and how we've helped them. We have to document all of our touches to you. A call, a phone call, follow up, leave a message. And then if we document, if we helped you through the application process. So you can call to schedule an appointment at any time. And then begin to gather your important documents. You're going to need your earning. What is your rent? What is your phone bill every month? These are probably numbers you don't keep in your head. How much do you receive from SSI or SSDI? Be patient. We will get to you. We have a lot of people every day completing this form, and they are on the list to be called, and we will get to you as soon as we can. But you can also, for me, you can actually click a link in my signature line of an email, and you can set up an appointment right on my calendar. Here are some issues that keep you from getting qualified or being approved for benefits: missing or erroneous information. This is why I recommend people set up an account in the SSA.gov, Social Security Administration. Half the time we enter somebody's social security number, it's either taken, it's the wrong number, or you've been a victim of identity theft and you don't even know it. So if you are not able to establish an account, you have to call Social Security and get that straightened out before we can even help you. We won't be able to apply unless you are able to have an account. Information provided is not detailed enough or specific enough about how your income is limited or how your disability affects your abilities. This is not the time to be coy or to withhold information. You want to be very transparent, and all the information should be out there. And then not submitting things on time or in a timely fashion. People, because of the nature of their disability, get letters. I've had people, a lot of people with autism, one person stuffed their backpack with all the letters they ever received from SSI, causing them to miss deadlines. We understand you're apprehensive about what the letter says, but not reading it is not going to help you at all. You'll miss deadlines and then you'll have to reapply all over again. Here are just some of the things you should get together: medical records. Every time you go to the doctor, they always offer you, would you like a printout of what we did today? Would you like a treatment plan? Take it and just put it in a notebook or folder. You could hole punch it and put it in a 3-ring binder, because that is the proof that you've been seen. All that information, you're not going to remember all the dates you were seen at the doctor. You're not going to remember what they did that day or who prescribed what, especially if you have a lot of doctors. You're going to forget. Having those papers that they give you, or going into your insurance portal, your benefits portal, to get the information. Just print something out every month that you have, and that will start to build your documentation. If you had an overseas divorce, if you're applying for any Social Security programs, you may be able to get benefits from a spouse or a parent if you have their Social Security number. So keep those things: birth or marriage or death certificates. And the Division of Vital Records for Virginia is in Richmond. A little bit more about get your records together. What to do if you are denied: you always appeal. Always appeal. It is easier to appeal than it is to start over. Plus, if you are applying for SSI or SSDI, the application clock is still ticking no matter when you start. So if you appeal, it's still ticking. But if you start and start over, if you stop and start over the application, you're setting a new clock. That means the difference between 9 months you've been working on this of back pay, as opposed to you starting over, and 2 months. Plus, they don't have that history if you start over. Everything you've been doing, you want to appeal. No is not the final answer. We are here to help. Don't be discouraged. We are helping you complete the forms. And with that, it's important to remember we are not the people who decide or grant or deny you the benefits. We are only knowledgeable about helping you apply and making the best case. We have no, sometimes people look at us like we are SSI or we are the Social Security Administration. We are not. We are not a nonprofit that helps people with disabilities get the things that they need to live a life of independence. And that means helping you apply. We have no control over the final decision that is made by people we don't even know who are in offices where we're not. All right, we have time for some questions. You can email us. These are our direct numbers. You can take a screenshot of this, or you can just certainly, I'll put it in the chat. Our offices are in Arlington, Virginia. I do work remotely. I don't often go to the Arlington office. We're able to do any of the applications online through this platform via Zoom or even just on the phone. There's really no need for us to be present. All of your documents and papers, you can upload them, scan them, what have you.
Tracee, I have a question.
Sure.
How long does the process normally take in terms of submitting the application to getting the results or whether the determination of whether you've been approved or rejected?
Mhm. For the 5 core programs, the Medicaid, the LAHEAP, the Medicaid Savings Plan, and the Medicare Part D prescription program, those can take anywhere from 4 to 6 weeks to get a determination. LAHEAP takes anywhere, you really just submit your application that you wanted, and that takes anywhere from 2 billing cycles. So if you apply in March, you should see the $500 credit reported on your Dominion account. March, April, May. In May, sometime that's 2 billing cycles, and you need to keep paying your bill no matter what. You don't want to stop paying it thinking that's going to take place. You need to pay something, even if it's less than you would pay, but at least keep the good faith that you're still paying your bill. For the SSI and SSDI, it can take anywhere from 6 to 18 months. It is the longest application to hear something back from. And some people have gone as long as 2 years waiting to hear and fighting with Social Security about their benefits, but anywhere from 6 to 18 months for SSI and SSDI.
Do you know if a person, for example, has applied for Medicaid and they've had to pay co-pays or pay bills related to their medical issues when they go to the doctor? Will
Mhm.
Medicaid reimburse, or are those just bills that they've had to pay and they're just out that money?
Sometimes they might reimburse, but it's really good to make sure you do it at the time of payment. Reimbursement can take a very long time. Certain things won't be reimbursed. It really just depends.
If someone wants to fill out an application for Medicaid or SSI, will there be assistance if they're not able to fill it out on their own?
Yes, we do. I complete the entire Medicaid application at the Common Help website, and I also do fill out the entire Social Security application online, sharing screen, so you can see what I'm inputting. But I'm really just inputting everything you tell me. So I'm able to type pretty fast and get through it a little bit faster, so long as you have the information. When you want to apply for Social Security, SSI, or SSDI, I send everybody a checklist of things that I want to look at before we even start. If you don't have those items, I don't want to start the application until you have everything, because the application could time out on us and it could be lost. The application can take anywhere from 2 to 3 hours, depending on your work history and your medical history. That is that's the parts that take the most time to put all the doctors in, their name, address, phone number, when were you first seen, last seen. Those are the longest parts. And if you don't have everything, I'm really sitting with you and Googling everything, because everybody's online. You can Google them, but you should go ahead and do that yourself so that it's all there and I can just type it in as you tell me. We have saved applications before, but I'm very skeptical to do that because I just don't want to lose everything that we've done. But you can save it and return to an application later.
That's what I was going to ask. That was my last point. That is there a time limit of when you start the application to when it needs to be submitted?
Mhm. There isn't a time limit. It's just I get very nervous if we have more than a few days. And also, you need a reentry number, and I keep it for the person. But you could go in and look on your own if you have your reentry number, and most people lose those things. What I would say one of the biggest hurdles to doing these applications is simply that people are not organized. They're not keeping good records or details of their medical and work history. The only thing I really have is I ask people to have a resume, which at least, even if it hasn't been updated in 10 years, gives us a starting point. People don't remember where they've worked or how much they made, and that can really bring down your benefit amount. If you can't come up with those numbers, the Social Security Administration doesn't have much to average. And it is an average of everything, which will determine whether you get all $960 a month or whether you'll get $600 to $300 a month. And that's pretty devastating if you just keep more detailed records and keep track of your information.
Well, with everything that is happening with Medicaid, I think it would be great advice for people to really make the effort and try to apply as soon as they
Mhm.
can. Thank you
Yes,
so much, Tracee, for
sure.
spending this past 50 minutes with us and explaining these processes.
Mhm.
We're hoping that people will take this video and share it with other people if they're interested in applying for Medicaid, SSI, SSID. So, um, I will make sure that in on the platform that I leave your name and information on there so that people can contact you, and also they can contact me and I will reference them to you. So again, thank you, Tracee, for joining us
Sure.
today. We
Thank you,
appreciate
Pansy.
it.
Mhm.
Very helpful information. And for everyone else out there, thank you for joining us and we appreciate it. And we will talk to you soon.